Ever heard of croup and wondered what it is? Croup is a common respiratory problem often affecting young children. Characterized by a distinctive barking cough, it can be quite alarming to hear. This video will guide you through an understanding of croup, delving into its causes, symptoms, and treatment. The aim is to equip you with knowledge, so you're better prepared if your child ever encounters this condition. Knowing about croup can help you understand when to seek medical attention for your child. Croup is a common illness that affects the windpipe, voice box, and bronchial tubes in children. This condition is essentially an infection of the upper airway that can make breathing difficult and cause a distinctive barking cough, almost like the sound a seal might make. This isn't just your everyday cough, it's harsher, louder, and can even be a bit scary to hear, especially if it's your little one making the noise. But while it may sound serious, it's important to understand that croup is typically a mild condition. Croup is most common in the chillier months of fall and winter, and it primarily affects youngsters between 6 months and 3 years old. So, as the leaves start to turn and the temperature drops, it's time to be on the lookout for this distinctive cough. This condition can be concerning due to its symptoms, but most cases are mild and can be treated at home. So, what causes croup and how can you recognize its symptoms? Croup is typically triggered by a viral infection, most commonly a parainfluenza virus. This virus inflames the area around the vocal cords, windpipe, and into the lungs, leading to the characteristic symptoms of croup. The most recognizable symptom is a barking cough that often sounds like the bark of a seal. This is due to the swelling around the vocal cords. Another common symptom is stridor, a high-pitched wheezing sound that's particularly noticeable when your child breathes in. Other symptoms can include hoarseness and difficulty breathing, and these symptoms can often amplify at night. The duration of these symptoms can vary, but they typically persist for several days and can last up to a week. It's crucial to remember that croup is usually more frightening than it is serious, but it's always wise to consult a healthcare professional if you're concerned. Being aware of these symptoms can help you identify if your child might have croup. How do doctors diagnose croup, and what are the treatment options? Well, doctors typically identify croup based on your child's symptoms and a physical examination. They listen for the telltale barking cough and stridor, which is a high-pitched wheezing sound when your child breathes in. Once diagnosed, most cases of croup can be managed at home. Rest, hydration, and the use of a cool mist humidifier can do wonders in easing your child's discomfort. The humidifier helps soothe the swollen airways and makes breathing easier. However, severe cases of croup might require medical intervention. Your healthcare provider may prescribe certain medications to open up the airways. These medications reduce inflammation and swelling, helping your child breathe more easily. In extreme cases, hospitalization might be necessary to ensure the child's oxygen levels are stable and they are breathing comfortably. Remember, when in doubt, it's always best to consult with your healthcare provider. Navigating through croup can be intimidating, but with a well-informed approach, you can help your child feel better in no time. So, to sum up everything we've learned about croup today, croup is a common respiratory infection in children, often caused by a virus, and characterized by a barking cough and difficulty breathing. Recognizing the symptoms early on can lead to a timely diagnosis and effective treatment. This may include medication, humidified air, or in severe cases, hospital care. Understanding croup can help you better care for your child during these uncomfortable episodes. Stay informed and stay healthy.